Okay. Good afternoon, everyone. Happy International Women's Day. Today, Creative episode is 175. Uh, Welcoming to Creative Weekend Talk. I am your host, Supriya Naika. It's my pleasure to have you all join us today. At Creative, we are committed to fostering knowledge, sharing, and discussions that inspire curiosity and awareness. As a registered trust, we continue to bring experts from diverse fields to light on a various topic. Our vision is to build a constructive thinking on various domains. Today, we address a vital health concern with the topic cancer in women, early detection and prevention. Our esteemed guest speaker, Dr. Aparna Srivastava, is a senior consultant medical oncologist at NH Shumoga. She holds an impressive academic and professional background, being the first medical oncologist in Central Karnataka, a gold medalist, an MRCP medical oncology UK holder, and an author of the Kannada book Cancer Ge Answer on cancer treatment. She is also a strong advocate for cancer awareness through social media and has published over 10 research papers in prestigious journals. She expertise particularly in breast cancer, oncology, preventive oncology, and will provide us with a valuable insights into how we can detect and prevent cancer in women at an early stage. And we are live streaming this program in our YouTube channel, Creative GBD. And without delay, I welcome you, ma'am, for today's session. I welcome
Thank you.
one and all for today's session. Over to you, ma'am.
Thank you. On this occasion, I'm very grateful to the Creative team for this great opportunity. And I wish all the women viewers International Women's Day. So I think it's a very pertinent topic for today, cancer in women. So I would like to take the help of the team slides. So if anyone can share the slides, it will be really helpful. So in today's world, we are seeing an increase in the number of patients in cancer. And this is our hospital, Narayana Health in Shumoga. So we are a comprehensive cancer center. We have all the cancer treatments that are usually used. Usually we use chemotherapy and radiotherapy and surgery for treatment of cancer. So our center is having an expert team of oncologists for treatment. So today's topic is early. Yeah, can you hear me?
Yes, ma'am. You go ahead. You are muted, ma'am. Just unmute yourself.
I have unmuted myself. So next slide, please. So yeah, in today's discussion, we will be discussing these four important subheadings. One is what is the burden of cancer in India, and what are the important cancers in Indian women, and what is the importance of early detection, and finally, when cancer is diagnosed, how we treat these cancers. Next slide. So if we see the non-communicable disease, major killer is heart problems. We hear of young patients dying of killers in non-communicable diseases. And the second one is cancer. But it is predicted that with increasing obesity and increasing alcohol consumption in India, in the next decade, cancer will overtake heart problems and will become the number one non-communicable disease. Next slide, please. So a lot of awareness to become aware of cancer. So if we see the global scenario worldwide, if you take the number of patients with cancer, China is number one, second is US, and India is top three ranking in global scenario. But if you consider China and US, they are far ahead of our economy, and even if they have so many number of cancer patients, they have the financial ability to handle the burden. But India, it is just moving towards developing country and developed country, and it is soon estimated that in the next decade, India will become the cancer capital of the world. So that's why a lot of awareness initiative is required in India to prevent cancers, and also to detect cancers in early stages. Next slide, please. So if you take the Indian scenario, there we are facing lot of problems. So compared to the Western world, in India we face lot of challenges. There is always a delay in diagnosis. So majority of the patients we diagnose in India are in advanced stages. They are always stage 3 or stage 4. And I'm sure you must have heard of patients in your own family and friend circle that when cancer was diagnosed, it was already stage 4. So the problem with stage 4 is that we cannot cure cancer. Patients end up spending lot of money for treatment, but still they are not cured, and there is a delay in starting treatment. So I work in Shumoga, it's a rural India, and when we say that you have cancer and you have to take treatment, there is a patients are scared. They're scared to take chemotherapy. They're scared to take radiotherapy. They're afraid that the treatment can cause side effects, and there is always a delay. Or they may be financially, they may be poor, and they don't have the finances to fund their treatment. So there is a delay in treatment. And even after the patient starts the treatment, okay, there is a cancer lump, and the patient has undergone surgery, then we tell them that okay, you have taken the tumor is removed, then next step is to take chemotherapy or radiotherapy. But the patient don't understand the seriousness of the problem, and they just don't come for chemotherapy at all. So incomplete treatment. So then later, after 6 months or 1 year, cancer comes back again in the form of recurrence. So then the patient is scared. So uh, all these challenges India is facing, and so all this delay in diagnosis, delay in starting treatment, incomplete treatment, all this is a financial burden for the country, and this is what we are. This challenge, somehow we have to break this barrier. Next slide, please. So let's understand what cancer is. So people ask me, is it infection? Is it some bacteria or virus which has caused this problem? So cancer is an uncontrolled growth. So in our normal body, we have a mechanism of repair. Suppose we fall, maybe during cooking, we have cut our fingers. So usually that cut heals in 4 or 5 days, isn't it? So sometimes, so the cells are tuned to divide only as much as it is required. Once the cut is healed, the cell division has to stop. But in cancer, when the cells have become cancerous, they go on dividing uncontrollably. So one cell, so a cell which was normally behaving, it goes violent. It becomes a rogue cell, and it starts to grow, divide uncontrollably, and that leads to the formation of a tumor. So so it manifests in the form of a lump or a swelling. So in this picture, you are seeing one patient who has a lump in the mouth, and this is a case of oral cancer. So this uncontrolled growth can happen in any cell of our body. So it can, if it happens in the liver, it's a liver cancer. It can happen in lung as a lung cancer, brain cancer, or in women we see breast cancer or uterine cancer. So it can happen anywhere in the body, and the basic mechanism is uncontrolled cell division. Next slide. So, as a patient comes to me and I tell them that, okay, this lump that you had in the mouth, it is cancer. So the next question they ask me is, why did I get cancer? What is the cause of cancer? So usually we have heard of tobacco and alcohol as the cause of cancer, isn't it? In movies, when they show the villain or the hero is smoking, they always write that tobacco is injurious to your health. Then when they are partying and having alcohol, they always show that, yeah, alcohol can cause cancer. So this tobacco and alcohol, they are both genotoxic. They damage the cell's DNA. So just like our entire body is controlled by our brain, every cell has a nucleus inside. So that nucleus is the one which controls the well-being of the cell. So when any damaging insult to our DNA, so that is when there is a damage to the DNA code, which causes a mutation. So any problem happens to the genes, an abnormal phenomenon called a mutation happens. So that mutation gives many different special features, so that that cell becomes a super cell, like a superhero. Just like Spider-Man can spin and he can jump and swing along the entire city, this cell, which was normal cell, becomes abnormal and starts to divide uncontrollably. So we are all aware of tobacco and alcohol as causes of cancer, but one thing which we are not realizing is that age. So as we age, the risk of cancer increases. So when the patient comes to me, they always ask me, why doctor, why my husband is having cancer? He doesn't smoke, he doesn't drink, he's a very disciplined person. Why did he have cancer? So aging itself can cause damage to our DNA or damage to our cell nucleus, which can cause, which can make that cell into a cancerous cell. So you may ask me how aging causes damage to the DNA. So our body is nothing but a machine which has multiple chemical reactions going on inside our body. In every cell, there are a lot of reactions happening. So when we buy a new mobile or a new bike or a new mixie, initially it works very well for many years, 5 years, 10 years. We find no problem with the new machine that we have bought. But with age, there is a lot of wear and tear, and even in our body, there are a lot of reactions are happening. So many byproducts of the chemical reactions are forming. So they all are damaging, and we are exposed to so many external environmental insults. Just you can take sunlight or ultraviolet rays. There are a lot of radiations in the environment which can cause damage to our cells. And there are a lot of endogenous insults, like our own hormones can cause damage to our cells, and that's how aging. From the time of inception inside our mother's womb, the fetus. Yes, can you, I mean, is everything okay?
Yes, ma'am. Go ahead.
Okay, I think, yeah. So, since the time of inception till death, we are exposed to so many environmental and endogenous insults, which can lead to damage to our DNA and cause mutations and cancer. So that's why we are seeing cancers in elderly patients. But these days, like last 2 decades, we are seeing a shift in the diagnosis of cancer in younger patients. So what is happening is that because of a fast lifestyle and lack of physical activity, lot of abundance with food, and eating lot of food and no exercise, there is obesity, which is causing accelerated aging. So the cancers which we were usually seeing in 60 years, 70 years, we are seeing in 30 and 40 years these days. So that's a very bad trend which is happening in India. So we are aging fast. We are we are taking tobacco and alcohol as a status symbol, and we are consuming these genotoxic agents. And genetics is also another important cause which we should never forget. Suppose your parents had cancer, your siblings had cancer, we may be dealing with hereditary cancers. So there are different genes which can be inherited by our parents. So in such families we see clusters of cancers in multiple family members. So you know about Angelina Jolie, right? So Angelina Jolie's grandmother had uterine cancer, and her mother also had cancer. She had ovarian cancer. Then she was found to have this hereditary breast cancer, and Angelina Jolie, she underwent bilateral removal of both her breasts. So genetics is another important factor we should all be aware of when we are dealing with cancer. And if you have any family history of cancer, you should be very strict in your lifestyle. You should always avoid obesity and resort to screening tests for cancer early detection. And last but not the least is viral infections. So we are all familiar with this human papilloma virus, HPV virus, which can cause cervical cancer. So the cervix is the opening of the uterus where cancers happen very frequently, and it is caused by human papilloma virus, which is a sexually transmitted virus. And other thing is hepatitis B, which can cause liver cancer. And there is always HIV, which can cause multiple cancers in HIV infected patients with AIDS. So next slide, please. So after learning all about the causes of cancer, let's take the top 5 cancers in Indian women and try to understand what are the symptoms of these cancers. So first one, so you must have read this book, Emperor of All Maladies. So cancer is called the emperor of all maladies. So if you take all the sadness, the emperor is cancer. So if you call cancer the emperor of all maladies, then breast cancer is the queen of all cancers in women. So this is the most common cancer in Indian women. And the problem with breast cancer is usually the earliest symptom of breast cancer is a lump. So I showed you that oral cancer patient had a swelling. So a similar swelling can happen in the breast. But the problem with the lump is that it is painless. Cancer acts very safe. So it's like a thief. Thief will not come to our house and knock the door. Thief will come and loot the house silently. So cancer also is very silent and painless in the initial stages. So the woman would have noticed the lump, but she will not bother because, okay, I can feel this lump, but it is not causing any pain. So they are not aware that a lump in the breast can be cancer. So they just ignore it for some time. So the property of cancer is that it not only keeps growing in the place of its birth, it can spread to different parts of the body. So if she doesn't take care of the lump, it will keep proliferating, it keeps growing, and it goes to the lymph nodes. So it usually goes to the armpit, and she will notice another swelling in the armpit. Usually, most of the patients, they come to me when they find another lump, which is also painless. They get scared that, okay, there was one, but now there is another one in my armpit. Okay, let me show a doctor. But some people in rural areas, even when it spreads to the armpit, also they are not worried because it's painless. And then it spreads to the neck. So another swelling happens in the neck. So many patients, they come to me with a lump in the breast, armpit, as well as the neck. And even if they are remaining silent even till this time, the lump can grow out of the breast in the form of an ulcer, or it can start bleeding from the nipple, or the nipple can get inverted, it will become inwards, and a dimple can happen in the breast. So these are all advanced stages of breast cancer. If we are seeing skin changes, if it is spread to the neck, then they're all advanced stages. So our motto is to create awareness so that when the lump is seen by the woman, that is the time she has to be careful and consult a doctor. So how does the woman find that there is a lump? If she has a practice of examining her breast often, she will come to know that there is a lump. So this self breast examination is an important step that every woman should practice. So usually, if you see the protocol of breast self-examination, you would have seen that, okay, you stand in front of the mirror, hands by your side, then hands up, then you have to lie down and see. So these are all very I think they are all cumbersome things which are very difficult to do in Indian scenario. So that kind of privacy, just think of a rural person. Does she have that kind of privacy to stand in front of the mirror and check herself that way? So such things are not required. So I advise a woman that, okay, while you are taking bath, you examine your own breast and see if you are feeling any lump. So that's the easiest way to examine oneself. And if you are finding any lump, you should always consult a doctor. So the most important thing is lump in the breast, and any skin changes, any redness, nipple blood from the nipple, or lump in the armpit, lump in the neck, they can all be signs of breast cancer. Next slide, please. So, after breast cancer, let's move on to another major killer in Indian women, that is cervical cancer, or the mouth of the uterus, which is called the cervix. So, as we discussed previously, the cause of cervical cancer is this human papilloma virus infection, and it's a sexually transmitted virus. And there are two things which are very important about this cervical cancer. One is that it is preventable with the vaccine. So if we take human papillomavirus vaccine, cervical cancer can be prevented. So who should get the vaccine? Children aged 9 to 15 years, they have to take 2 doses of vaccine. And if the child is more than 15 years to 45 years, you have to take 3 doses of this vaccine. And this can prevent cervical cancer. And many a time I get women who are like 45 years, 50 years, they come and ask me, should we take this vaccine? So it is said that once a person has started their sexual activity, they may be already infected with virus. So once you are already infected with virus, you may not benefit from HPV vaccine. So it is also So we have to vaccinate our children first. And if you are more than 30 years, there is a test which can detect cervical cancer in early stages, which is called a pap smear. So you go to your gynecologist, they will examine your cervix if it is normal, and they take a scraping from the mouth of the uterus. From cervix they take a test, and this is to be done once you are more than 30 years of age. So this can lead to early detection of cervical cancer. So once a cancer has already happened, the woman may experience a lot of problems in the form of pain after sexual activity, bleeding from bleeding in between their menstrual cycles. Like once a month menstruation is happening, but in between, like 15 days, 20 days, there is bleeding in between the menstrual cycles, or there is excess of menstrual bleeding, white discharge from the vagina. They are all early signs and symptoms of cervical cancer. So I see that many women, they think that all these menstrual problems are normal. They say that, okay, I had a lot of stress, my children had exams, that is why I was under a lot of stress, and that's why the periods got changed. So it is always better to consult the doctor than to assume that it is because of normal variations. So cervical cancer is an easily preventable cancer with HPV vaccine, and it can be screened with a test called pap smear, which every healthy woman who is above 30 years has to get every 3 years they have to get. So another thing which I forgot to mention in breast cancer is, even for breast cancer there is a test for early detection which is called mammography. Next slide. So the symptoms of cervical cancer we have already discussed. There is abnormal vaginal bleeding, unexplained vaginal discharge, pain during sexual activity, low backache. These are all symptoms of cervical cancer, and a woman should not neglect their menstrual problems, saying that they are due to stress and all. It should. So what happens with women is, during pregnancy and all, they're very prompt. They always go to the doctor for their pregnancy related follow-ups. They don't miss any scan. They get it promptly because they're worried of the baby. But after that, they are not very keen on their own health, and they tend to neglect their own menstrual problems. So that is very important, that any of these symptoms, doctor's visit is mandatory. Next slide. So oral cavity and throat cancers are very important in India. So as I told you, there is tobacco. So earlier I used to think that okay, tobacco is all this men's game, and usually men are more addicted to tobacco, especially smoking. But in rural India, I see that women are addicted to tobacco as much as men, not in the form of smoked tobacco, not cigarettes, but in the form of gutka and this tobacco. So tobacco is, as we discussed, it is genotoxic. Wherever it goes, when we chew, it affects the mouth, throat, food pipe. Wherever it goes, it burns the coverings of the mouth and food pipe, and it can cause cancer. So women should always be saying no to tobacco. Not only women, men should also not indulge in tobacco or alcohol. And some people, they'll have both alcohol and tobacco. So the A plus B is even more worse than consuming both the agents alone. So the head and neck cancer, that means oral, throat, and food pipe cancers are very rampant in rural India, and they can be easily prevented by just quitting tobacco. But once a patient quits tobacco, suppose you quit today, your cancer risk will come down only after 10 years. So till 10 years, the damage which has been caused, it will still be there. So it is always better to quit the tobacco early, and a woman should always be careful. Usually women are very worried about their children, whether they'll become addicted, they'll be vigilant. So even women themselves should be saying no to tobacco, and also should safeguard their spouse, that they should also not indulge in tobacco or alcohol. So oral cavity, what are the symptoms of this oral cancer? There may be a non-healing ulcer, an ulcer which forms on the tongue or in the mouth. It may not heal for many months. So such a non-healing ulcer in the mouth can be cancer. And usually these women, they keep this betel nut and the gutka and keep it inside their mouth, and they sleep also. So usually at that place, mouth cancer develops. And even when it happens in the food pipe, they cannot swallow food, and they can swallow only liquids. So such symptoms can be due to esophageal cancers of the food pipe. And another important thing is the throat. So any voice change, hoarseness of voice, can be because of tobacco related cancers. Next slide, please. So another thing, last one is this cancer of the large intestine. So this in rural India, the large intestine cancer, usually there will be blood in the stools. So any blood in stools is attributed to piles. And there are all these natural healers and herbal healers. They say that without operation, we will cure piles. And they keep treating the patient for many months, and the bleeding in the stools, it will not stop. And one finally, when they come to us, they'll have a big tumor in the colon, and it would have already spread to liver also. I see so many patients coming with stage 4 colon cancer, because they thought that it is piles and they were afraid to come to the hospital. So large intestinal cancer is an obesity related cancer. Though we were poor a few decades back, India is heading towards affluence, and we are embracing junk foods, and we are overeating. And because of this obesity pandemic, we are seeing an increase in the large intestinal cancers, and blood in stools is the first. So one more thing is, in just like a lump anywhere in the body can be cancer, any bleeding can be due to cancer. So be it blood in stools, blood in your cough, or you vomited blood, or any menstrual bleeding, so nasal bleeding, any of these can be due to cancer. So any bleeding we should not neglect, saying that it is piles, and we will take natural treatment. So it's always better to consult a doctor, and usually they do an endoscopy called colonoscopy, which can easily detect colon cancer. Next slide. So these are the stages of cancer. Usually patients ask, why did the cancer spread? So that more time you give, it will spread. So usually stage 0 is where it is the cancer is just forming. Stage 1 is that it has grown in breast, and then stage 2 is where it spreads to the armpit, and then stage 3 is when it has perforated the skin and it has started to bleed. So many women, they come with pus oozing from the breast. The lump has ruptured, and it is causing pus and blood, and that is when they come to us. So then stage 4 is when it has spread to different parts of the body. So we should never allow cancer to reach stage 4. Our intention is to detect the cancers in early stages, that is stage 1 and stage 2, where we can cure the cancer with appropriate treatment. Next slide, please. So, what is the importance of early detection? Early detection can save lives by curing the cancer. So, even before the symptoms of cancer start, we can do some tests which are called cancer screening tests. So, these tests they detect cancers in early stages before even signs and symptoms of cancer start. So it is usually done in healthy women like me. I'm totally all right. I don't have any symptom. I don't have a swelling. I don't have bleeding. But I'm interested to know if I already have cancer which is growing in my body. So what are the tests which can be done for early detection of cancer? Number one is mammography for breast cancer. So mammography is an X-ray of the breast. So a simple X-ray of the breast is taken and it can detect cancers in early stages. So who should get a mammography? If your age is above 40 years, even if you don't have any problem, you have to do a mammography for early detection of breast cancer. So you should do it every 2 years to safeguard against breast cancer. And the second one is pap smear. Pap smear is for cervical cancer. Any woman above 30 years of age should do a pap smear every 3 years. And stool for occult blood is for colon cancer, where stool testing is done after age of 40 years, and it can detect if there is any tumor which is bleeding into the gut. It can be detected. Then last is the examination of oral cavity. If you are a tobacco chewer or a smoker, then oral, you have to examine your own mouth in the mirror for any ulcer, swelling, or white or red patches which can be early stages of cancer. Next slide. So this is how mammography is done. It is the X-ray of the breast. The breast is placed between the X-ray plates, and X-ray is taken. So if your age is 40 years and above, you have to get the mammography every 2 years. Next slide, please. So pap smear is scrapings from the cervix, which is taken if you are more than 30 years. So this is a test which many women have never heard of, not got. So it is very important that after the age of 30 years, you should consult the doctor for annual health checkups, just like how we check the BP and sugar and cholesterol, thyroid. Just like that, cancer screening tests also should become very common in India. Next slide. So, suppose unfortunately cancer has already diagnosed, what are the treatment options for cancer? So, first thing is that the tumor can be operated by surgery and the tumor can be removed. So, the problem with surgery is that only early stages, stage 1 and stage 2, can be operated. And if it is already advanced stage, the surgery may not be able to cure cancer because it has already spread to all different organs of the body, so that surgery will not be helpful. The second important treatment option is radiotherapy or radiation, where X-ray like um they are all these invisible rays, like just like X-rays. Multiple rays of X-rays are used, and usually they are a beam of protons and electrons, which are of high energy, and they can burn the tumor cells. It is a non-invasive. You don't have to operate. Just you have to. Uh, 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 we have to plan it in such a way that the patient goes into the machine just like how we go for a CT scan or an MRI, and that tumor is marked and the rays are they are directed towards the tumor so that they get burnt inside the body, and that can cause cancer cure. And third treatment option is chemotherapy. That is my department. So chemo means chemicals, therapy means treatment. So with the help of chemicals in the form of tablets or injections, cancer can be controlled. The advantage of chemotherapy is that it is given directly to the bloodstream, and travels all across the body in the bloodstream, and wherever cancer has spread, be it your brain or liver or lungs, it travels everywhere and eliminates the cancer cells which are hiding, which have spread all across the body. So, but again, the problem with chemotherapy is that it is very toxic. It can cause a lot of side effects. But these days, there are multiple antidotes for many of the side effects of chemotherapy. So, we are giving chemotherapy a lot safer than the yesteryears. Next slide, please. So we have almost come to the end of our discussion. So we have learned so many things about what causes cancer. So now you all know how you can prevent cancer. Just quit smoking or tobacco chewing, quit alcohol, and prevent obesity. I think maybe tobacco and alcohol are easier to quit, but preventing obesity or being physically active is a big challenge in this fast paced world. So every day you dedicate at least 30 minutes of your time for physical activity and maintain your body weight in normal range, whether you are premenopausal or you have had a child or you are menopausal, whatever be your age. Women should always strive to maintain a good normal body weight and prevent overweight. And we should always indulge in a balanced diet rich in fruits and vegetables. So why fruits and vegetables are important? So the genotoxic effects of chemotherapy are because of free radicals. So the cancer is caused by free radical damage, and the fruits and vegetables, they have a lot of antioxidants which are like sponge, and they absorb all this bad energy which can cause damage to our DNA. So that's why we should have at least 5 servings of fruits and vegetables. So usually in our sambar or sabji, we always put vegetables, but fruits we don't consume that much. At least 3 servings of fruits a day is mandatory. You don't have to eat 3 different types of fruits. Whenever I tell about fruits, patients ask about dry fruits, whether dry fruits are good. Both dry fruits and fresh fruits are very good. You don't have to eat exotic fruits. My patients ask me whether they should have kiwi fruit or dragon fruit. I tell them that even guava and banana, all the simple seasonal fruits which are grown in your vicinity, they are better than these exotic fruits which are imported from far off countries. But by the time they reach your place, half the minerals and vitamins may have already got deactivated. So always indulge in fresh fruits which are seasonal and they are easily available. And 2 important vaccines, we should always vaccinate our children with hepatitis B virus and human papilloma virus. So hepatitis B is easy because every child that is born in India is given hepatitis B vaccine from the government initiative. But human papilloma virus is not available freely in India, but it should be every child should be vaccinated with HPV also. Next slide. So the take-home message for today is cancer is curable if detected in early stages, and we should not wait till we develop cancer. We should always indulge in screening tests. Every year, I tell people that when you are having your wedding anniversary or your birthday, that month you dedicate for cancer or any annual health checkup. So that month you go to the hospital and get your annual health checkup done. Always do your screening tests. And symptoms of cancer like lump anywhere in the body or bleeding should not be ignored. And cancer can be prevented with a good lifestyle by quitting tobacco, alcohol, and by maintaining a normal body weight. Thank you. Yeah, this is a screening mammography camp. So I told you about mammography. So what happens in rural areas is that this mammography machine, it's like X-ray machine, but it is not available in the villages. So we have this bus which has an inbuilt mammography machine. So we take this bus and we go to the nearby villages, and it's a free mammography camp we do to sensitize women to get the mammography test done. Next slide. So this is a breast cancer survivorship clinic which we are running in our hospital. So what happens with breast cancer is patient, they get treated, they recover also, and they become cancer free. But the society, they look down upon them that oh, she had cancer. Look at her hair. Look at her breast. It is removed. So they face a lot of discrimination in the society. So we run this survivorship clinic to motivate them and to do some little psychological counseling and help them to come back to normal life. Next slide. So, yeah, this is Cancer Ke Answer. This is the book I have written in Kannada. It's about cancer treatment. So the foreword was written by our the chairman of our Narayana Health, Shri Dr. Devi Shetty sir, and he came to Shumoga for the book launch also. So the book is doing very well. People are reading it and they're getting motivated. They're not scared of cancer anymore. They're taking cancer treatment. So that's something which I did in Kannada. Next slide. Yeah, that's the end of it. So if you have any questions, I am very happy to answer any of them.
Thank you, ma'am. It's a very awareness creating session for us. Okay, ma'am, just I want to ask you, in rural areas, we can't explain all these things normally for the common people. What should we do for the those women who are suffering innocently like this? How you are creating awareness in those people, ma'am?
So the easiest way to break the barrier is to speak in their own language. So I started my campaign in Kannada so that people can understand. So sometimes this mechanism of how cancer is formed, they may not be able to understand the exact mechanism. But if we tell them that, see, you feel your own breast every day, and if you are having any lump, it can be cancer. So I have actually created lot of I did lot of campaign, and many patients, there are these ASHA workers. So I do the training for ASHA workers, who they are all these Anganwadi workers. So I train them that, see, if anyone tells you that she has a lump in the breast, it can be cancer, you refer her to your doctor. So usually PHCs will have doctors. So that way, with the help of these Anganwadi workers and healthcare workers, we are trying to create awareness.
For testing and all, ma'am, usually in rural areas, they won't uh, go, and even the availability is very less.
Yes,
As
yes,
we
I totally agree. Correct.
city side, we can easily go and check it out. But in rural side, one of the barrier is uneducation regarding this, and another
Correct.
availability is very less.
Yes. So what happens is that government is funding for treatment. Suppose you are taking chemotherapy or radiotherapy, government is funding for treatment. But for prevention, government is not giving anything. Like it is not sponsored by the government, and many of the insurance companies also. So even if you are educated and if you have insurance coverage also, they don't cover the preventive checkups. So that's a big challenge in India.
Yes, ma'am. Okay, ma'am, one thing. During the first stage, any weaknesses that we can experience, anything No.
Nothing will be there, madam. Yeah. Only so recently, recently I had a 55-year-old lady who came
Mhm.
with breast lump, and we did mammography, we did biopsy, and it was diagnosed as cancer. It was stage 1 cancer. It hadn't spread anywhere. So that patient's daughter, she got very furious. She told me, "What, madam? My mother, she walks for 5 kilometers every day without any problem. She walks with my own pace. She can walk so fast. And you are telling she has cancer." She said that I can't believe it. So I told, see, this is what it is. When we detect cancer in very early stages, they can have no other problem other than the lump. So many people, they don't believe also. They will say that, oh, doctors are trying to fool us. And so some such cases, I tell them, okay, you go to another oncologist, you take a second opinion, you get it checked again. If you are doubting us, go to another doctor. If they also say that it is cancer, you please take treatment, because early stage cancers can be very silent. Patient will not have any symptom like loss of appetite, loss of weight, not able to eat. They will not have any such symptoms. Lump can be the only symptom of cancer.
Ma'am, at least one stage to second, first stage to second stage, how much, how many days it will take, ma'am? Any
It
average?
Sometimes it will not go step by step, madam. They don't follow books. They just from stage 1 they go to stage 4 directly. So you may not get any time at all. So many patients, they feel cheated. They feel that, madam, if I knew that this breast lump was symptom of cancer, I would have come to you last month only. From last month I had this, but it has already become stage 4. So it doesn't give time. That's why we have to be very careful. The moment you notice any change, any swelling, bleeding, please go to the doctor immediately. It's always better that we be aware that, okay, any lump can be a cancer. So something very funny happened. Not funny, I don't know what should I say, maybe mysterious. One patient came to me. He was a 70-year-old male patient. He is a farmer. So I asked him, what problem do you have? He said, "Madam, I don't have any problem. I have this swelling here. My barber said that you are having this problem, maybe something problematic. You go to the doctor." So then we did the testing, and he had a similar swelling in the throat also. So it was throat cancer which had spread to the neck. So this patient, he didn't have any other symptom other than that lump.
Okay, barber shop.
Barber diagnosed.
They,
Yeah.
yes, yes.
Yeah.
Fortunate.
Yes, correct.
Any other questions from audience? You can unmute and yes, Giridhar sir.
Good afternoon, ma'am.
Good
Actually, it's
afternoon, sir.
very good information about the cancer and detection and prevention. I need one information about blood cancer. How can we detect that blood cancer, and what are the symptoms of that one, and also how can we prevent that one, ma'am?
Blood cancer is something which comes like bolt from the blue, sir. It is like these thunderbolts and this lightning which comes. It will come suddenly and doesn't give lot of time. So usually what happens with blood cancers is that they are very fast growing, and within weeks patients are not totally normal. Then they start getting fever. They may have some bleeding, usually blood from the nose or blood in the stools. And when they get a testing for this fever, we come to know that the white cells are very high or very less. The platelets fall, just like dengue fever. Usually platelets fall, no? So similarly, the platelet counts will fall. So blood cancer is something which cannot be screened. So when I told about the screening tests, we don't have screening tests for every cancer. That is another problem that we face. If there is a test which can detect all early stage cancers, we can tell patients that, okay, you do all these 15 or 20 tests, and we will detect all cancers in early stages. But unfortunately, we have this screening test only for slow growing cancer. Suppose the cancer is growing slowly over many months or years, we can detect it with screening tests. But blood cancer is something which is very fast. It will grow in weeks, so that we cannot do tests to detect blood cancer in early stages. But when they get symptoms like fever, they're having bleeding, and they're having lumps, that is the time they come to the doctor, and that's when we do the tests and do the diagnosis.
Thank you, ma'am. Ma'am, and one thing you are doing camps by taking that mammography vehicle.
Yes.
In which places you are doing, ma'am? That means
Usually around our Shimoga, we around some 100 kilometers around Shimoga we are doing.
Any
great.
other people who are doing near Bangalore or anything, ma'am? Any?
Yeah, ma'am, there is this Niramai. They are doing around Bangalore. I can get you the details, ma'am, so that their condition is that at least 25 women should be there for the bus to come. So if you can gather 25 women, they'll come and do the test freely, free of
Yes.
cost.
Actually,
Yes.
Gauribund also near to Bangalore.
Bangalore. I can give you contact. NH Bangalore also is doing these camps, madam. So you can contact N. I'll give you the contact so that you can organize one camp near your place.
Actually, they were doing so many camps, blood camps like that. But this is
Yeah.
somewhat different.
Very
Yes.
required also, ma'am.
Yes, yes.
This awareness
Correct.
is very much required, and
Yes.
after second, third stage, we can't do anything. So
Yes.
early detection is prevention.
Correct, correct.
Yes, ma'am. Give the contacts with our team will provide all the
Yeah,
facilities
sure.
to
Yes,
do
yes.
Gauribund.
Yes. Yeah,
Thank you so
no
much.
problem. Okay.
Any other questions? Kagli sir? Okay. I think no question from audience. Ma'am, any hospitals which are conducting this free testing and all? Any
Yes, ma'am.
suggest some hospital names, ma'am?
Yes, ma'am. NH Bangalore does it periodically, ma'am. I can give you the contact numbers of the
Government
NH.
hospitals, ma'am. Any government hospital?
I don't know, ma'am. I don't know whether I can find out and I'll tell you, ma'am. Yes,
Okay.
ma'am. Yeah.
Okay. Okay, ma'am. Thank you very much. It was
Okay, ma'am.
very informative, and one thing we have to be very conscious about these things.
Yes,
After
yes, correct.
listening this, no, we have to test ourselves, it seems.
Yes, yes. Correct,
Yeah.
ma'am. Correct.
Thank you very much.
Okay. Yeah.
Thank you, one
for
and
this
all,
great.
for. Yes, ma'am. Thank you very much.
Yes, ma'am. Okay.